Attention seniors. If you're over 60 and watching your hair thin out day by day, thinking it's just part of getting older, stop right there. What I'm about to share with you in the next few minutes could be the game changer you've been desperately searching for. You see, while everyone's telling you that hair loss after 60 is inevitable, there's one critical vitamin deficiency that's silently robbing millions of seniors of their beautiful hair. And it's not what you think. I'm talking about a deficiency so common in people over 60 that it affects nearly 40% of seniors, yet most doctors never even test for it. Stay with me because what you're about to discover could restore not just your hair, but your energy, your mental clarity, and your confidence. This isn't about expensive treatments or harsh medications. This is about one simple vitamin that could transform your golden years. Before we dive deep into this life-changing information, I want you to do something right now. If you're watching this and you're over 60 and you've noticed your hair getting thinner, I want you to hit that like button. And if you know another senior who's struggling with hair loss, please share this video with them right now. It could literally change their life. Also, drop a comment below and tell me your age and how long you've been dealing with hair loss. I read every single comment, and your story could help other viewers realize they're not alone in this struggle. Now, let's get into the information that could transform your hair and your life. Let me paint you a picture that might sound all too familiar to many of you watching right now. You wake up in the morning, and there's more hair on your pillow than you remember seeing before. You run your fingers through your hair in the shower, and clumps come out in your hands. You look in the mirror and notice your scalp showing through in places where you once had thick, beautiful hair. And here's what makes it even more heartbreaking. When you mention this to your doctor, they nod sympathetically and say, "Well, that's just what happens as we age. It's genetics. There's not much we can do about it." But here's the truth they're not telling you, and this is something that could change everything for you. Age-related hair loss is often not just about genetics or hormones. It's about a critical vitamin deficiency that becomes epidemic after age 60. You see, as we get older, our bodies undergo dramatic changes that most people, including many healthcare providers, don't fully understand. Your stomach acid production decreases significantly after 50. Your digestive system doesn't absorb nutrients like it used to when you were younger. Your kidneys don't process vitamins as efficiently as they once did. And certain medications that seniors commonly take actually block the absorption of crucial vitamins that your hair desperately needs. The result of all these changes is devastating. You could be eating a perfectly healthy diet, taking a handful of supplements every morning, drinking your green smoothies, doing everything right, and still be severely deficient in the one vitamin that your hair follicles desperately need to survive and thrive. This is exactly what happened to my patient, Margaret, a vibrant 67-year-old grandmother who came to see me absolutely devastated about her hair loss. She had always been proud of her thick silver hair. It was her signature feature, the thing people complimented her on. But over the course of 18 months, she watched helplessly as her hair became thinner and thinner until she could see her scalp clearly in certain lighting. Margaret wasn't someone who gave up easily. She'd been to 3 different doctors seeking answers. They ran comprehensive blood tests for thyroid problems. Everything came back normal. They checked her iron levels multiple times. Always fine. They even did extensive hormone panels, everything within acceptable ranges for her age. Each doctor told her the same frustrating thing. "It's just aging, Margaret. Maybe try a different shampoo or consider a wig." But Margaret wasn't satisfied with that answer, and neither was I when she became my patient. Because what these doctors missed, what they failed to check, was her vitamin B12 levels. And when we finally did that simple test, we discovered she was severely, dangerously deficient. Her B12 levels were so low that she was at risk for permanent neurological damage. Here's what most people don't realize about B12 deficiency in seniors, and this is crucial information that could save your hair and your health. It's not just about hair loss, though that's certainly a major and visible symptom. B12 deficiency creates a cascade of problems throughout your body that can mimic many conditions we typically dismiss as normal aging. The hair loss happens because B12 is absolutely essential for DNA synthesis in rapidly dividing cells, and your hair follicles are among the most rapidly dividing cells in your entire body. B12 is also crucial for proper oxygen delivery to hair follicles through healthy red blood cell formation. Without adequate B12, your red blood cells become large and malformed, unable to carry oxygen efficiently. Additionally, B12 maintains the health of the nerve endings that supply your hair follicles with vital nutrients and growth signals. Finally, B12 supports the cellular energy production that keeps hair growing strong and healthy. When you're B12 deficient, your hair follicles literally starve. They can't get the oxygen they need to function. They can't produce new cells efficiently because the DNA synthesis process breaks down. The nerve supply to your follicles becomes damaged, disrupting the growth signals. Eventually, your hair follicles go dormant or die altogether, and once they're dead, they may never recover. But here's the scary part that most seniors don't realize. B12 deficiency doesn't just cause hair loss. It comes with a whole host of other symptoms that doctors and patients alike often dismiss as just getting older. These include overwhelming fatigue that no amount of sleep seems to fix, memory problems, and mental fog that make you worry about dementia, depression, and mood changes that seem to come out of nowhere, weakness in your legs, and balance problems that increase your fall risk, numbness or tingling in your hands and feet, shortness of breath during normal activities, unusually pale skin, and of course, significant hair, thinning, and loss. The real tragedy here is that all of these symptoms are completely preventable and reversible if caught in time. But if B12 deficiency goes untreated for months or years, some of the damage, including permanent damage to hair follicles, can become irreversible. This is why recognizing the signs early and taking action is so absolutely critical. Now, here's where Margaret's story, and potentially your story, gets incredibly exciting. Once we identified her severe B12 deficiency, we immediately started her on what I call a proper B12 restoration protocol. And I want to emphasize the word proper, because this is where most people, and even some healthcare providers, get it completely wrong, wasting time and money while your hair continues to fall out. You see, if you're a senior with B12 deficiency, simply walking into a pharmacy and buying regular B12 tablets off the shelf probably won't work. And here's exactly why. As we age, our stomachs produce dramatically less hydrochloric acid and significantly less of a protein called intrinsic factor. Both of these are absolutely essential for absorbing B12 from food and even from regular oral supplements. So, you could be religiously taking B12 pills every single day, spending money on expensive supplements, and still be profoundly deficient because your aging digestive system simply can't extract and utilize the B12. This is exactly why we started Margaret on sublingual B12. That's the kind that dissolves under your tongue and gets absorbed directly into your bloodstream through the tissues in your mouth, completely bypassing your problematic digestive system. The transformation that followed was nothing short of remarkable, and it gives me chills every time I think about it. Within the first week of starting proper B12 supplementation, Margaret called my office with genuine excitement in her voice for the first time in months. She said, "Doctor, I don't know if this is psychological or what, but I swear I have more energy than I've had in literally years. I actually wanted to clean my house yesterday, and I haven't felt like doing that in ages." By week 3, she noticed something even more encouraging. She wasn't losing nearly as much hair in the shower. The alarming clumps that used to come out in her hands were now just a few normal strands. By week 6, Margaret was practically bouncing when she came for her follow-up appointment. Not only had her hair loss completely stopped, but she could actually see tiny new hairs growing at her hairline and filling in some of the thin spots. Her mental fog had lifted dramatically. Her energy levels were higher than they'd been in years. She was sleeping through the night for the first time in months. Her mood had improved so much that her family kept asking what had happened to make her so happy again. By month 3, the transformation was visible to everyone around her. Margaret's hair had noticeably thickened. Her family and friends were constantly asking her what she'd done differently, what treatment she'd gotten, what expensive procedure she'd undergone. She was sleeping better than she had in years. Her mood was consistently positive and optimistic. She'd even started taking ballroom dance classes again, something she'd given up because she felt too tired and unsteady on her feet. But here's what made me most happy as her doctor. When we retested her B12 levels after 3 months of proper supplementation, they had gone from dangerously low to completely optimal. We had literally reversed years of progressive damage with one simple, inexpensive intervention. Margaret had gotten her life back, her confidence back, and most visibly, her beautiful hair back. Here's exactly how B12 works its incredible magic on your hair, and understanding this will help you appreciate why this vitamin is so crucial. First, B12 is absolutely essential for cellular energy production. It's required for proper mitochondrial function, and mitochondria are the powerhouses of every cell in your body. Hair follicles are among the most metabolically active cells you have, constantly dividing and growing at an incredible rate. They need enormous amounts of energy to maintain this activity, and B12 provides the fuel for this cellular energy production. Second, B12 is crucial for DNA synthesis. Every single new hair cell that your follicles produce requires perfect DNA replication. Without adequate B12, this DNA synthesis process becomes faulty and inefficient. Your hair follicles literally can't produce healthy new cells, so hair growth slows down and eventually stops altogether. Third, B12 is necessary for healthy red blood cell formation. Better, properly formed red blood cells means significantly better oxygen delivery to your hair follicles, keeping them healthy, active, and productive. Fourth, B12 maintains the health of the tiny nerve endings that supply your hair follicles. These nerves carry crucial growth signals and nutrients. When B12 levels drop, these nerves become damaged, disrupting the communication between your nervous system and your hair growth cycle. Finally, B12 is involved in complex methylation reactions that directly affect gene expression related to hair growth and the timing of your hair growth cycles. Now, let's get completely practical and specific. Here's exactly what you need to know and do to potentially transform your hair loss situation step by step. First and most importantly, you absolutely must get tested before you start any supplementation program. You need to know your baseline levels so you can track your progress and adjust your approach accordingly. Call your doctor's office and ask specifically for a complete B12 panel. This should include serum B12 levels, a methylmalonic acid test, and homocysteine levels. These 3 tests together will give you the complete picture of your B12 status and how it's affecting your body. Don't accept vague answers about your results being normal. Many laboratories consider B12 levels between 200 and 900 picograms per milliliter as normal, but for optimal health and hair growth, Seniors should aim for levels closer to 400 to 600 picograms per milliliter or even higher. If your doctor says your levels are fine but won't give you the actual numbers, insist on seeing the results yourself. Once you have your test results, you can determine the right supplementation approach. For mild B12 deficiency, start with sublingual methylcobalamin at 1,000 to 2,000 micrograms daily. Take this first thing in the morning on an empty stomach and allow the tablet to completely dissolve under your tongue without swallowing. For moderate deficiency, increase to 2,000 to 5,000 micrograms of sublingual methylcobalamin daily. You might want to consider alternating between methylcobalamin and another form called hydroxycobalamin for maximum effectiveness. For severe deficiency, like Margaret had, you should start with B12 injections. These typically involve 1,000 micrograms injected weekly for 4 to 6 weeks to rapidly restore your levels, then transition to high-dose sublingual supplements at 5,000 micrograms daily. Always work closely with your healthcare provider to monitor your levels and adjust your dosage as needed. Timing and absorption are crucial for success. Always take your B12 first thing in the morning for optimal absorption. Avoid taking it with coffee or tea, as these can interfere with absorption. Don't take B12 with other vitamins initially. Give it 30 minutes alone to maximize absorption before taking other supplements. If you're on medications like metformin for diabetes, proton pump inhibitors for acid reflux, or certain blood pressure medications, you may need significantly higher doses because these drugs interfere with B12 absorption. B12 works best when combined with other B vitamins that support its function and hair growth. Include folate at 400 to 800 micrograms daily, as this is essential for B12 utilization in your body. Add vitamin B6 at 25 to 50 milligrams daily to support overall hair growth and protein metabolism. Consider biotin at 2,500 to 5,000 micrograms daily to strengthen hair structure and reduce breakage. While supplements are usually necessary for deficient seniors, you can support your supplementation with B12-rich foods. These include wild-caught salmon, which provides 4 to 5 micrograms per serving, grass-fed beef liver, which is incredibly rich with over 70 micrograms per serving, sardines with 8 to 10 micrograms per serving, fortified nutritional yeast with 2 to 4 micrograms per tablespoon, and eggs from pasture-raised chickens with 0.5 to 1 microgram per egg. Several lifestyle factors can significantly impact your B12 absorption and utilization. Manage your stress levels actively, as chronic stress rapidly depletes B vitamins throughout your body. Limit alcohol consumption, as alcohol severely interferes with B12 absorption and storage. Address any gut health issues you might have, as probiotics and a healthy gut microbiome can improve nutrient absorption. Stay consistently hydrated to support optimal cellular function. Get adequate, quality sleep to support nutrient utilization and cellular repair processes. Monitor your progress carefully by keeping a simple daily diary. Track your energy levels on a scale of 1 to 10 each day. Count the hairs you lose in your brush or shower drain to quantify improvements in hair loss. Note your sleep quality and how rested you feel upon waking. Monitor your mental clarity and ability to concentrate. Record your overall mood and sense of well-being. You should start noticing improvements in energy and mood within 1 to 2 weeks of starting proper supplementation. You should see a reduction in daily hair loss by week 3 to 4. New hair growth typically becomes visible by 6 to 8 weeks, though it may take longer if you've been deficient for years. Once your B12 levels normalize and your hair loss stops, you'll need long-term maintenance. Continue with maintenance doses of 1,000 to 2,000 micrograms daily, as your absorption problems won't disappear with age. Retest your B12 B12 levels every 6 months to ensure you're maintaining optimal levels. Stay vigilant for returning symptoms, as they can indicate that your levels are dropping again. Remember that as you continue to age, your absorption capacity may continue to decline, so you may need to adjust your supplementation over time. Here's exactly what I want you to do right now, today, to start your journey back to healthier hair and renewed vitality. First, call your doctor's office today and schedule an appointment specifically to discuss B12 testing. Don't wait for your next routine visit or annual physical. Tell the receptionist that you want to schedule an appointment to discuss vitamin B12 deficiency and request a complete B12 panel, including serum B12, methylmalonic acid, and homocysteine tests. Second, start documenting your current situation right now. Take clear photos of your hair from different angles, including the top of your head and your hairline. Write down your current energy level on a scale of 1 to 10. Make a list of any other symptoms you've been experiencing that you might have dismissed as just aging, including fatigue, memory problems, balance issues, or mood changes. Third, review all your current medications with your pharmacist or doctor. Ask specifically if any of them interfere with B12 absorption. Common medications that block B12 include metformin, proton pump inhibitors like omeprazole, H2 blockers like ranitidine, and some antibiotics. If you're taking any of these, you may need higher doses of B12 or more frequent monitoring. Fourth, share this life-changing information with other seniors in your life. B12 deficiency is absolutely epidemic in people over 60, and you could literally save someone's hair, health, and overall quality of life by sharing what you've learned today. Send this video to your friends, family members, or anyone you know who might be struggling with unexplained fatigue, hair loss, or other symptoms of aging. I want you to commit to what I call a 30-day hair restoration challenge. Get your B12 levels tested within the next week. Start appropriate B12 supplementation based on your test results and your doctor's guidance. Take daily progress photos and keep notes about how you're feeling. Share your journey with family or friends for accountability and support. Most importantly, come back to this video in 30 days and leave a comment about your experience and results. Here's my personal promise to you based on decades of clinical experience and hundreds of seniors I've successfully helped with B12 deficiency. If you follow this protocol consistently and your hair loss is related to B12 deficiency, I'm confident that you'll see meaningful, visible improvements within 30 to 60 days. Your energy will return, your mental clarity will improve, your hair loss will slow and then stop, and new growth will begin to fill in the areas that have thinned. But remember, timing is absolutely crucial. The sooner you start addressing this deficiency, the better your results will be. Hair follicles that have been dormant for months may take several months to revive and start producing healthy hair again. Hair follicles that have been dormant for years may take much longer to recover. And sadly, some follicles that have been dead for too long may not recover at all. This is exactly why taking action right now, today, is so critically important. Leave a comment below this video and tell me your age and how long you've been experiencing hair loss. Share what other symptoms, besides hair loss, you've been dealing with that you might have been attributing to normal aging. Let me know whether you've ever been tested for B12 deficiency, and if so, what your levels were. Finally, make a public commitment to trying this approach so that other viewers can support you and follow your progress. I personally read every single comment on my videos, and I'll respond to as many as I possibly can. Your success story could be the inspiration and proof that changes another senior's life forever. Remember, you absolutely do not have to accept hair loss as an inevitable part of aging. Sometimes the solution is far simpler and more accessible than you ever imagined. Take control of your health starting today. Take immediate action and prepare to be completely amazed by what your body can accomplish when you finally give it exactly what it needs to thrive.